This is News Hour coming to you live from GBC News. Hello, good evening. I'm Siyoko Kwakuche. Welcome to the news.
Good evening. My name is Shirley and Jonathan in Team Darko translates the news into sign language. We start off with some health news, and this segment of the news is brought to you by Lufat. Lufat is from Tobinco. Ghana's COVID-19 infection cases have been increasing over the past weeks, basically driven by the Omicron variant. 1,074 new cases of COVID-19 have been recorded as of December 28, 2021. The country currently has over 9,000 active cases, while 1,287 have succumbed to the virus.
The Greater Accra region continues to lead the charts with thousands of infections. The sharp increase in active cases has caused alarm among a cross-section of Ghanaians, with some health analysts warning of a possible fourth wave of the pandemic in the country. The Ghana Health Service is urging Ghanaians to support the government to prevent the spread of the virus by ensuring strict compliance with COVID-19 safety protocols. Meanwhile, a total of 6,924,267 vaccine doses had been administered as of December 20, 2021.
Last week, the Greater Accra Regional Security Council issued a directive that no one would be allowed to board any public transport without wearing a nose mask. And what our news team saw in Accra on Wednesday is an indication that many people in the country, including commuters and commercial drivers, are not wearing the nose mask, although they acknowledge that the virus is still lingering.
What I can say is Ghanaians like perception is too much. That there was no any coronavirus, and then it's just a perception for the government to, do his own things. No, the sickness is real. I have experienced it last year by this time. Yes, of course. Yes, I couldn't breathe. I couldn't do anything. All what I can see is my family, my children, my wife around me. That is all, but I can't do anything. But through our herbal medicine, they were able to, take good care of me, and I was able to survive. Within the 5-6 days,
you see some people, they wear nose mask, some people don't wear nose mask. And if they are sitting they sit together. So I wanted to ask, is it that way? Like, is it true? Because what is going on too? You don't understand, because they say the sickness is system.
Because me nose mask ne share me bag, masha my bread. Do baby na me home no eti. Ntina se me yi ne kakra, e kakra na masan hye.
But you say there be about Omicron. Okay. And nose mask no dey obebre share bag no hanum. We are no se tamaso monti no. Yeah, we are no so sana se hye sana ha say chinchinti fa continue. Then you manage from now on.
For now, it's dangerous, and I'm appealing to the public so that everybody should be wearing the mask, the nose mask. As you can see, I didn't wear my own, but from here I'll start wearing it so that everybody should be safe. If you didn't go for the vaccination too, I think you have to go for it. It will help us.
Because we are all aware of the coronavirus and we know its effect. Therefore, if you love yourself, you protect yourself. And the only way to protect yourself is to wear the mask and observe the protocols. My advice is that everybody should observe the protocol, and number one is to wear the mask. That is what is going to protect us. And also we should learn to wash our hands. You know, we are in the Harmattan season and you can see the dust. We don't know what is in the dust. You can see that most people are suffering from it now. And you don't know who has it. You see, so it's advisable we protect ourselves. Even if you can double the mask, fine.
The Greater Accra Coordinating Council is reiterating its directive on measures to curb the spreading coronavirus this Christmas and New Year season. These include the compulsory wearing of face masks, washing of hands, and strict adherence to the safety protocols in all public transport and public places. The Chief Executive of the Accra Metropolitan Assembly, Madam Elizabeth Saki, says with the surge in active cases of the Omicron variant of COVID-19, especially in the Greater Accra region, the Assembly is embarking on a nose mask wearing campaign.
And we are seriously embarking on no mask, no entry. And then wherever you go, have the full mask covered, your nose up there down to your chin, which is the appropriate thing, not halfway or pulling it down. And especially when you're talking, you don't have to expose it because it's more dangerous up there for anybody around you. It's really true. I just come from Fadama, and I can tell you, it's not that they are not aware. They were in the know, and they know it's not the best. But they try to come out with excuses just to think that they are set free. But I think that with the enforcement of no mask, no entry into a vehicle, and then the social gathering should be adhered to, washing of hands is also needed. And those are things that today, even when I had gone to Old Fadama, I tried to ask them, and when I questioned them, they were able to narrate all. So it tells you that it isn't something that they don't know, but deliberately they think that this thing is on the low, so they can. But I told them that's not it. It's rather going high, and we need to kettle it at the appropriate time. Well, for the general, I want to wish everybody a Merry Christmas and a Happy New Year. Yeah. Long life and prosperity.
All items, including food products, are by law supposed to have expiry dates on them. For this reason, all manufactured products have expiry dates or best before written on them. However, some retailers tamper with expiry dates on products that are no more usable and sell them to unsuspecting consumers to the detriment of their health. The Food and Drugs Authority is therefore entreating consumers to always remember to check the expiry date of products before they buy or consume them, especially during the festive season.
Date markings are good manufacturing practices widely accepted internationally. Date markings on food products and other items have implications for both the manufacturer and consumer. These dates are determined by conducting what is called stability test on the product after manufacturing, sometimes taking into consideration the weather condition for the product's marketing destination.
The date markings for maybe the same manufacturing date for a product which is being brought to Ghana may have a different expiration date from one that you find as the same product and date of manufacturing, having a different date marking for expiration in the ones that are going to be displayed in the temperate region. So these are part of the considerations we take when we have to vet these products and then allow them to be approved or accepted for use in the country.
The date markings come in several ways, either the exact date, that is, the day, month, and the year, or only the month.
So for instance, 12th December 2021. It means that the product will go bad on that date. There are times that you can only have an indication of the month. When it happens that way, you, the consumer, is expected to interpret that to mean the end of that month. So if it is 12/2021, then we mean the end of December 2021, which is the 31st. It goes bad. The manufacturer is not going to be able to guarantee the safety and quality of the product from that day onwards.
About 5 out of every 10 people check the date markings on the product before they buy. Others don't.
Kenya here, if you're sure I can mark expiring date, you can be in a home.
Ni efe tumo chemicals can be yem. Wasani always call I of fish wake. They expiring cash hey.
To make sure send your money may far. Say if it is less than 6 months, I may far because minimum there besa. The expiring date in the winya pa.
2021 me wo yo call I asa no he no year 2020 no year here 23 low 24. Esa no ba ses asa no yo.
Some traders, in their quest to clear their stock of products that are about to expire, tamper with the date markings or sell them at giveaway prices. This is what the FDA is cautioning against.
A day or two to the time is still wholesome. There is no point in destroying them. Rather, we advise that if you are buying these products, then you should be aware of your own consumption trend. Sometimes consumers seeing that these things are coming at a far cheaper prices than they really are supposed to be. Their greed begins to determine what to do, and therefore they sometimes go for so much which they know they will not be able to consume within a certain space of time.
The head of communication and public education at the Food and Drugs Authority, FDA, Mrs. Reda Apia, says, while products labeled best before may only have reduced in taste and quality after the specific month, expired products should not and cannot be consumed at all.
What's best before really means is that the manufacturer says that I will not be able to guarantee the safety or the quality of the product from the end of this time. It may not have gone bad most of the time with food. It may not have necessarily gone bad, but if it's biscuits, it might have flattened, and therefore the taste would have changed, and you should not expect the same level of quality when you consume it.
Health experts say people who consume expired products do so at their own risk. For GBC News, Mavis Ofei Champon reporting.
At a forum to assess its performance in the year under review, management of the Upper West Regional Hospital says despite challenges at the facility, it will continue to provide quality health service to people in the region and beyond.
With a staff strength of 900, including 30 doctors, the Upper West Regional Hospital has in the last 2 years provided services to almost 100,000 people in the region and beyond. As a secondary health service provider, the hospital also provides health care to patients from other parts of the north and Burkina Faso. To help improve on its operations, the hospital engages its clients annually in an open forum. Dr. Robert Amesia is the medical director of the hospital.
Since our existence, we have attended to close to 100,000 people at the OPD. A lot of people have been admitted and operated. We began with 4 doctors. As I talk now, the doctor population has crossed 30. But I think looking at the population of Wa and the districts under the Upper West region, 30 doctors is still not enough. But in less than 2 years, I think this is something that it's not too big, but it's something that we can celebrate.
The Regional Director of Health, Dr. Damien Punguyeri, acknowledged the support of the traditional authorities and other partners in the operations of the hospital. He, however, advised the people not to run down the facility.
This is the only hospital that we have that when district hospitals cannot handle, they will bring here. And so we should be interested in helping to shape the quality of service delivery in the hospital rather than running it down. Because when we succeed in running it down, we are all going to go down.
The residents commended the hospital's management and staff for ensuring continuous flow of potable water and providing shade and security. They called for the establishment of a fund that will support patients who cannot afford medical bills.
The health segment of the news was brought to you by Lufat. Lufat is from Tobinco. Away from health, Government has, through an executive instrument, renewed the curfew imposed on Boko in the Upper East region. In the latest directive, movement is expected to cease from 8 p.m. to 8 a.m. daily, effective Wednesday, December 29, 2021. This is to help restore calm in the Upper East regional capital. A statement from the Interior Ministry says there is a total ban on all persons in the aforementioned communities and the environs from carrying arms, ammunition or inoffensive weapons, and any person or persons found with any arms or ammunition will be arrested and prosecuted. According to the statement, there were gunshots in the early hours of Monday, December 27, 2021, which resulted in the loss of lives and the destruction of properties in the township. The Interior Minister, Mr. Abideri, called on the chiefs, elders, opinion leaders, youth and people of the area to exercise restraint in the face of the challenges confronting them. The statement further called for peace building through non-violent means.
The head of corporate affairs of the National Identification Authority, Mr. Abdul Ganiyu, says an initial application for a Ghana card does not attract a fee. However, when a first-time registrant opts for NIA's premium service, then a service charge of 250 cedis is to be paid. He spoke earlier to GBC News.
There are some other services that we are yet to roll out at the regional and district offices. And these are card replacement services, updates of personal records. And for the updates of personal records, to the extent that it leads to the printing of a new card, then the applicant would pay an amount of 30 Ghana cedis. And people who have also lost their cards and are coming for replacement, they would also pay a fee of 30 Ghana cedis. Aside that, registering for the Ghana card for the first time, it remains free for all Ghanaians. Registration currently taking place at the NIA headquarters. That comes with a fee of 250 Ghana cedis because that is a premium registration center. This is provided for by law. Another service known as institutional registration. So if GBC were to call us to come to your premises and register your staff over a period, then each person will pay an amount of 100 Ghana. That is institutional registration. Then there's also what we call the household registration. So a family sits at home, calls on the NIA to come and register them. Each person will pay an amount of 150 Ghana cedis. And that's what we call the household registration. So these are the instances that chiefs are going to apply. But of course, we've also got a report of some of our officers who demand money before people are registered. And when those instances are brought to our notice, we have taken steps against those people. Ghanaians must understand that once you go to the registration center and people are demanded for money, just give us the appropriate evidence to go after those people. And anybody at all who asks for money from you before registering you for the first, please say no to it. If it has to do with the update of your record or the replacement of card, you are going to be given a receipt before that service is rendered to you.
The founder and president of the Worldwide Miracle Outreach, Reverend Dr. Lawrence Tete, has advised religious leaders to desist from making false prophecies in an On GTV Breakfast, Dr. Tete admitted that some religious leaders are culprits in publishing prophecies which have the tendency to cause fear and panic. The call comes in the wake of a directive from the Ghana Police Service about the legal implications of what it calls prophecies of harm, danger and death by some religious leaders.
It's very unfortunate. The police instruct the church how to handle spiritual matters. It is how low we have sunk the church. And certainly it's not the fault of the police. Church is supposed to be instructing the politicians, the pressmen, the police, the army, to be admonishing them. Now the police is admonishing the church because a few individuals have reduced the church into where we are. So I feel very sad.
And it feels like everyone wants to outdo the next person. Is that how we've got here?
In the days of old, we'll have the good, the bad, and ugly. So definitely there will be a few wrong things done by certain individuals that affects all and sundry. In fact, one of the greatest gifts God gave to humanity, mankind, is prophecy, where you admonish, you guide, and you also rebuke. I sit here today as a pastor, and I must say, if you say Lawrence Tete is going to die tomorrow, my mother will come after you. My brothers will come after you. My sisters will come after you. And so if you go public, you've created panic for the people. There's been instances where prophets have had a word about kings and leaders. Prophet Isaiah went straight into the house of Ezekiel, the king, and told him, put your house together, you're about to die. That is a wise prophecy. That's a prophecy that is given in discreet. That's a prophecy that is given with wisdom. And that's also the prophecy that has some level of circumspect, that we don't abuse those. And I think this is also a caution to all of us. As much as some people will be embarrassed about this and some people will be concerned about it, I think it's a wake-up call that we shouldn't open the door for anybody to say. The fear of death is more ugly than death itself. So we need to be very mindful how we do it. And what I keep saying since yesterday when I saw the circular is that it is we, the church leaders, that have allowed ourselves to come to this extent. So we need to correct the wrong.
Meanwhile, legal practitioners Mr. Musa Ahmed and Mr. Francis Xavier Sosu have urged the police to prosecute persons found culpable of causing fear and panic within the remit of the law.
Even though the statements are just advisory, the key criminal element there is the use of the word causing fear and panic, which is an offense under criminal offenses. And I think if you exceed the limit of exercising your religious freedom, you can be sanctioned by law. If the statement was made and there is evidence that a statement has caused fear and panic among the and we can have a few individuals to come and prove the kind of effect it had on them, which amounts to fear and panic. Then you are in the area of proving your case. It is not directed exactly at the individual for the statement per se. It's the intent, the act, the result of his utterances. Clearly, what the police need to do is to even cast a doubt in the religious mandate and the spiritual mandate of every man of God and every prophet across the country. We are yet to see the progressive and the pragmatic steps police has put in place for purposes of arresting or reducing the kind of crime rate that we have had in this year. And yet we are so much quickly and in a hurry to regulate prophecies.
Where should we draw the line?
We have laws that regulate those things. When a person causes fear and panic, arrest the person and prosecute the person per the laws that we have. But don't seek to bring directives that would cast doubt in the entire Christian religious space, cast doubt on prophecies and potential false prophecies. Why do you protect the mind of people to think that, well, the 31st December is coming, prophecies will come, there will be false prophets, prophecies, and they are likely to cause fear and panic, and so you are warning ahead of time. For me, that is wrong. We don't have to accept that.
You're still watching is live on GBC News and Governance Channel. Residents of Dom Nujose in the Dom Kwabenya municipality are up in arms about an obstruction of the road from Dom Kwabenya through Taifa by a private developer. The agitated residents said the private developer has constructed a washing bay with a lone wall which, apart from blocking access to the road, also causes flooding when it rains.
In a protest to press home their demands, the residents said they live in fear because of lack of access to the area in case of a fire outbreak. According to them, it will be difficult for a fire tender or an ambulance to save the situation. They said all efforts to have the washing bay removed have failed. A spokesman for the Residents Association, Mr. Ben Amuzu, said they are forced to walk a long distance to the main road because of the obstruction.
Assemblies, let us go home. I go be some. Say yet me kwana na omo be boy na ba kire say ye nsu ye say bet na ye dia o me de o beta engineer o ma engineer be kire converse na be to na abo no nyama na e say de ye kwan no engineer no ba mu e be kire e na eto aso ye kwan no e du bia mo say ye njai ti ase but eja na ba kwan no so ti na e twen say e bia mo ma kwan na ye de abedi ma ba to aso up to 93 ye hu na so ye kwan no.
Some of the residents are unhappy that the authorities are looking on unconcerned.
When we cut Taifa, Banchiase, Ashoma Estate, Kwabenya, Ekoho, what I said, Naminim Ghana, say a debito bifia, ambulance, fire service, Minakwa, Kwai Nipa Bako Pet, Nano Bianisi Copeti, or no Siquano, Amatima Mufu Bread.
The residents appealed to President Akufo-Addo and the Member of Parliament, Madam Sarah Adwoa-Safo, to step in. Meanwhile, the residents have threatened to pull down the wall if the authorities do not do anything about the situation.
News coming up in this package. Please stay.
Hello, this is Business brought to you by MTN and Whirlpool. My name is Esther Edu Ohumewu. He was a teacher but made a switch to full-time agriculture. He's now calling the shots in the agriculture sector. Currently, this farmer is training the youth within his community and is ensuring that they adopt modern farming practices. This is the story of 50-year-old Mr. Michael Barr, who has tilled the land for the past 30 years. Beatrice Senadu visited Mr. Barr's farm at Kotoso in the East region and has more in this report.
It was one of my many visits to rural Ghana that I chanced upon Mr. Michael Barr. He has tilled the land for the past 30 years and has about 1,200 acres of farmlands at Kotoso, a farming community in the eastern region. Over the years, Mr. Barr has cultivated cocoa, cucumber, watermelon, maize, okra, cabbage, onion, among others. At the time of my visit, he was cultivating about 103 acres of onions. He shares his humble beginnings.
I started farming with my father, who passed on 2018. He trained me seriously. So throughout all my educational levels, I still maintain my profession as a farmer. So about a year or two now, and I stopped teaching and then get into full-time farming business. And I know it is very, very good and it helps a lot because I can provide for people to consume and also get money.
Mr. Barr currently employs 94 permanent staff and about 350 casual workers who are paid daily. It was refreshing to see students after school join Michael on the farm to acquire some farming skills and also get some badly needed cash for their education. On his onion farm, Mr. Barr tells me he is able to harvest about 320 bags of onion on a busy day. He further shares that onion farming is profitable but capital intensive, and also monies invested into it can be recouped if the farm is properly managed.
If we do our things well, we can supply more than necessary. Because I alone has cultivated about 183 acres. Another person can do so. But because of the farming facilities, the irrigation facilities and the land acquisition and hiring of excavator to put all the stamp from the land, it's very, very costly. So if you don't have money, you can't do big. But if the facilities are there and if the government supply us or is able to give us all the irrigation facilities along the lake, I assure you, we can produce and produce more than necessary.
He says it takes 4 months to harvest the onions, and also that not much is needed to venture into agriculture. He started with meager resources with support from his late father.
I bought my first machine, now 50 Ghana, that's 500,000 cedis. Old, 50 Ghana, the machine, the pipes, and then the sprinklers. By then, so just small money that I used to start the business, and supported by my father, as he wanted me to overtake him.
29-year-old Bright Anoba is an SHS leaver who works on Mr. Barr's farm. Anoba tells me he has no regrets becoming a farmer. He is currently mastering agribusiness on the farm and also saving money to further his education. His dream of becoming an architect in future is gradually becoming a reality.
What I've seen here is a very good work, and as I'm standing here, that is what I'm going to do in my future. So I'll call them, or I'll tell them that they should also come and learn something like this here, so that it will help them in their life. Because where the world is going, we have to plan very well. If not, one day our generation will suffer.
Mr. Ba has therefore called on all to see agriculture as a business and disregard the notion that agriculture is for the poor. He however pleaded with government to provide an enabling environment to help farmers to thrive. He has a word of advice for the youth.
If they get themselves in farming business, it will help them a lot. It will help them. It will help them to earn a living. Because these 94 people, I'm not sure somebody will go to even at work. Some are graduates, but still they are working under me and they know what they are getting from the farming business. So you go and stand on the streets, demonstrating at the course of the day. You go and beg for food, it is bad.
Agriculture plays an important role in improving the economies of many countries around the world. It provides employment opportunities for rural people on a large scale in underdeveloped and developing countries, including Ghana. Though the sector faces many challenges, which include aging farmers, the situation is gradually changing as many young people are now taking bold steps into the agri sector. For Mr. Michael Ba, the future is bright. He remains optimistic the issue of unemployment will be reduced if agriculture is made attractive to the youth. His belief is that this will help to improve living standards and also reduce poverty in the country. Beatrice Senaju, GBC News.
And that's all for business, brought to you by MTN and Whirlpool. Thanks for watching.